Hey there, parents and caregivers. Are you excited about your baby's first tooth? When do those pearly whites actually start popping up? And what's the deal with molars? Don't worry, I've got you covered. In this video, we'll dive into everything you need to know about your baby's teething schedule. First things first, let's talk about when babies usually get their first tooth. It's typically the bottom front tooth, also known as the lower central incisor. This tooth tends to make its grand entrance around 6 to 10 months of age. But keep in mind, every baby is different. Some might get their first tooth earlier, while others might take a bit longer. Now, let's move on to molars. These are the bigger teeth in the back of the mouth. Babies usually get their first upper molars between 13 and 19 months, and their first lower molars between 14 and 18 months. The second set of molars? They typically show up fashionably late, between 23 and 33 months. And just like with the first tooth, the top molars usually come in before the bottom ones. I know what you're thinking. How long is this teething thing going to last? Well, I've got some good news and some bad news. The bad news is that teething will continue until all of your baby's teeth have made their debut. The good news? Not every tooth will cause your little one to fuss. Some babies breeze through teething without a care in the world, while others might need a bit more comfort and cuddles. Speaking of comfort, let's talk about ways to soothe those sore gums. One of the best tricks is giving your baby a frozen washcloth to chew on. You can even dip a corner in apple juice before freezing it for a tasty treat. Another option is a mesh bag filled with ice chips. Your baby can safely suck on the cold goodness without any risk of choking. And if you're breastfeeding, you might notice your baby wanting to nurse more often. That's totally normal. Nursing can be super comforting during teething. Now, let's break down the teething schedule. Kids will eventually get 2 sets of teeth. The first set, known as baby teeth or milk teeth, start showing up in the first year of life. These teeth will eventually fall out around age 6 or 7, making way for the second set, called permanent teeth. In total, your little one will have 20 baby teeth. That's a lot of chompers. But it's not quite as many as the 32 permanent teeth that will eventually take their place. Here's a quick rundown of when you can expect each tooth to make its appearance. For the upper teeth, the central incisor usually erupts between 8 and 12 months, followed by the lateral incisor between 9 and 13 months. The canine, or cuspid, shows up between 16 and 22 months. The first molar pops in between 13 and 19 months, and the second molar between 25 and 33 months. As for the lower teeth, the central incisor typically erupts between 6 and 10 months, with the lateral incisors following between 10 and 16 months. The first molar makes its appearance between 14 and 18 months, the canine between 17 and 23 months, and the second molar between 23 and 31 months. Let's not forget about those permanent teeth. They start coming in around age 6 or 7 and continue until about age 21. Here's a quick breakdown. For the upper permanent teeth, the first molar erupts between ages 6 and 7, followed by the central incisor between ages 7 and 8. The lateral incisor shows up between ages 8 and 9, the first premolar between ages 10 and 11, and the second premolar between ages 10 and 12. The canine makes its appearance between ages 11 and 12, the second molar between ages 12 and 13, and finally, the third molars, aka wisdom teeth, erupt between ages 17 and 21. Moving on to the lower permanent teeth, the first molar and central incisors erupt between ages 6 and 7. The lateral incisors follow between ages 7 and 8, the canine between ages 9 and 10, the first premolar between ages 10 and 12, and the second premolar between ages 11 and 12. The second molar shows up between ages 11 and 13, and the third molar makes its fashionably late entrance between ages 17 and 21. Now, let's talk about how to care for those shiny new teeth. It's important to start good dental hygiene habits as soon as that first tooth pops through. Here are a few tips to keep in mind. First off, avoid giving your baby frozen gel packs, amber beads, or anything containing numbing agents like belladonna or benzocaine. The FDA has issued warnings against their use. Stick with safer options like frozen washcloths or food-grade mesh bags with ice chips or frozen fruit. Once that first tooth appears, it's time to start brushing twice a day with a grain of rice-sized amount of fluoride toothpaste on a baby toothbrush. By age 3, most kids can handle a pea-sized amount and should start rinsing and spitting, since swallowing too much fluoride isn't good for them. If your tap water doesn't contain fluoride, consider asking your pediatrician about fluoride supplements around 6 months of age to help strengthen your baby's tooth enamel and prevent decay. Your pediatrician may also recommend applying a fluoride varnish to your baby's teeth for added protection against cavities. And there you have it, everything you need to know about your baby's teething schedule and how to care for those precious pearly whites. Thank you for joining us today. If you found this video helpful, don't forget to like, share, and subscribe for more insightful content.